is Diagnosis Glaucoma with your hosts, Dr. Mona Kaleem
and Dr. Harry Quigley.
Hello, and thanks for joining us again. Today on episode 34, we're going to be talking about dropless glaucoma medications. This is a novel method of glaucoma drug delivery, and it's a very important topic because not everyone can use eye drops. We have a special guest for you today, and that is Dr. Jella An. She's one of our colleagues at Johns Hopkins. Dr. An, can you tell us a little bit about yourself?
Hi, Dr. Kaleem. Thank you for inviting me to your podcast today. I'm a glaucoma specialist and an associate professor of ophthalmology at Wilmer Eye Institute in Johns Hopkins.
And I do want to add to that the chief of the practice out in our Bethesda location for anyone who's thinking about making an appointment. And so I wanted to ask you, Dr. An, what are some of your research interests?
So my interest in research is really in minimally invasive glaucoma surgery and treatment, and that includes an extend-release drug delivery system.
And how did you actually get interested in this topic?
So I got interested in this topic for the same reason that got me interested in the field of ophthalmology to begin with. So while many medical students go into medicine so that they can save people's lives, I went into medicine because I wanted to improve patient quality of life, which is what drew me to the subspecialty of ophthalmology specifically. As you know, most glaucoma patients require lifelong control of their eye pressure, and this often requires consistent daily use of eye drops, sometimes multiple of them, several times a day. And this can be incredibly challenging for many patients, especially our elderly patients. In recent years, several minimally invasive glaucoma procedures and treatment options have become available as an alternative to these daily glaucoma medications. And because most of these procedures are very safe, they allow earlier intervention as an option to replace daily medication use, addressing the issues of medication adherence, and thereby improving the quality of life and oftentimes quality of vision for many glaucoma patients.
This is, again, a very important topic because some of our older glaucoma surgeries are not applicable to every patient. The downtime is longer, healing time is longer, etc. And, frankly, again, not everyone can use eye drops. There's lots of barriers to the use of eye drops, which we'll discuss in a moment. Actually, what are some of those, Dr. An? What are some of the things that you have found to be true? Because I have read statistics that indicate that only around 50% of patients are actually compliant or adherent to their medical therapy. What are some of the challenges that you see amongst your patients in terms of their ability to use medications?
Yeah, no, you got it right. Many of the studies have well documented that only about a half of patients prescribed a glaucoma medication use it as directed. Many of these studies also utilize either a self-report or refill rate at the pharmacy, so it's probably underreported too. Actually, back in the day in 2014, we did a study that compared a self-reporting questionnaire on how patients perceive they are using their eye drops versus objective observation of how they're actually administering their drops. And we did so by videotaping each patient. And these were my own cataract patients on the day one post-op. And I was appalled by what I saw on the videotape. In fact, over 90% of the patients showed an improper drop administration technique, including missing the eye, contaminating the bottle tip, that was really common, instilling either too many or too little drops at a time. Oftentimes they were missing the eye. And most of them not washing their hands before using their eye drops, even though on their survey they said they always wash their hands before instilling the drops. Those people with the particular difficulty were found to be those with, hands arthritis, poor dexterity or tremor, or even impaired vision, as you can imagine. Many patients need to rely on their family members to help. And that can be also challenging too when the required dosage is more than once a day.
So, Dr. An, if you had to use eye drops every day, what do you think your compliance would be?
Oh my God, it's going to be so terrible. So I have dry eye syndrome that requires use of, artificial tears more often than not. But, I always forget to use it. Only time that I remember to do it is at the bedtime, because it's sitting on my bedside table. But, those are, other than those hand arthritis and dexterity issues, forgetfulness, busy schedule, traveling, those are a very common problem with not being able to adhere to drops. Running out of the drops, or not being able to refill it on time. That became a major issue, especially during the time of the pandemic, because you have to actually go to the pharmacy. Sometimes the insurance refused to renew the medication if you run out too fast. And that happens when you're constantly missing the eye. Affordability is often an issue with a newer medication that is often more effective than older ones, but they're much more expensive. And most seriously of all, medication side effects. That includes allergic reaction, either local or systemic, irritations, burning, redness of the eyes, and some systemic side effects with certain medications, such as beta blockers, and they can be pretty serious.
What are some of the bad side effects you've seen to glaucoma eye drops?
Well, allergic reaction, even if it's not the true allergic reaction, redness and irritation is a very, very common side effect. And that's because most topical medication often require a harsh surfactant or preservative, or even sometimes a low pH to get into the eye, because when you're using medication topically, there's a limited bioavailability of the active ingredients. These ingredients has to somehow get into the eye to get past the sturdy cornea. So they often use these harsh ingredients as a necessity to get the, drop delivered into the target tissue. And then, these in turn can irritate the ocular surface with the long-term use.
Yeah, we actually had an episode earlier this season where we talked with Dr. Anissa Geary about dry eye and how there's a higher incidence of dry eye with individuals who use glaucoma medication. And although there are preservative-free glaucoma medications, those can actually be kind of pricey and not always available. So it's great that there are now drop-free glaucoma medication alternatives. And I know that you have done some work in this. What are some of the things you can tell us about the drop-free glaucoma medication alternatives? And I'm talking more about actual use of medications as opposed to surgery.
Right. So, drop-free ocular medication, the idea of it is not new. So, in fact, most places now offer a drop-free cataract surgery by injecting depot of a post-op medication at the time of the surgery so that you don't have to rely on having to use the drops after the surgery. Challenges with developing a drop-free glaucoma medication specifically are the fact that they are often required to be used for a lifetime, not just for a few weeks. And most sustained release vehicle that we use has a limited lifetime. Another challenge is that any extended release medication that lasts for a long time needs to be safely removable if a patient develops any unknown, unexpected side effect. So there's several options that meet those criteria. Those are contact lens, impregnated with the medications, periocular ring in the conjunctival cul-de-sac, or tear duct plugs. Those are easily placeable and replaceable. Unfortunately, as you can imagine, these options don't bypass the ocular surface. So if your reason not to use the drop is because of the ocular surface issues or allergic reaction, they are not very good options. Instead, these are often used for treatment of ocular surface issues such as dry eyes or allergic conjunctivitis, or sometimes, to treat the non-infectious inflammation of the eye. For those people who are having difficulty using drops because of the ocular surface side effect, you really need to go for implantable or injectable option. And currently there's one FDA-approved extend-release glaucoma medication implant that is injectable, and that's, brand name Duresta, and made by Allergan.
And so Durista, so that's an injectable medication. What is that medication? Is it something that's pre-existing or like a brand new class of medications?
So Duresta is an injectable bimatoprost, which is one of the standards of care glaucoma medication that's been used for over 20 years. It's a family of prostaglandin analog, the bimatoprost, and it's in a drop form. The brand name Lumigan is one of the most effective and well-tolerated glaucoma medication that's not known to cause any systemic side effects. So it was a very good candidate to make it into an injectable form. Unfortunately, it can frequently cause a redness, irritation, and all those ocular side effects. And another thing is that, obviously people have difficulty using it daily for all the reasons that we talked about. So Duresta addresses all of these issues.
Yeah, I do have some patients who take the topical version, so the Vimatoprost, or the brand name is Lumigan, and it can be harder to afford that medication. There can be issues with like prior authorization and running out of the medication before the end of the month, because the bottle is designed so that patients basically get enough medication for 28 days. But as we know, not every month is 28 days. So exactly where is it injected? And can you tell us a little bit more about how long it works and how it works?
Yeah, sure. So Duresta utilizes the microcapsule that slowly releases the bimatoprost molecule inside of the eye, and it is injected into the anterior chamber, which is the front part of the eye. In fact, the same microcapsule is used for the steroid medication in the posterior chamber for a patient who actually have a, inflammatory disease. So it's called the Ozurdex. It's made by the same company. So the benefit of putting it in the anterior chamber is that it delivers the molecule directly into the target tissue, which is where the ciliary bodies and the trabecular meshwork is. Those are usually where the disease pathology is. Curiously enough, the effect of the intraocular pressure lowering, the eye pressure lowering, often lasts longer than the medication does, the life of medication. So medication is only supposed to last 3 to 4 months once injected. But we often see a patient have a sustained intraocular pressure lowering for more than 6 months, sometimes up to 2 years. The exact mechanism of this really remains to be proven, but it may be because of, when you inject this medication in a higher dose directly into the eye where there's a site of the target tissue, it potentially has a disease modifying capability, but that is to be, further proven.
And, having an injection to the eye does sound a little bit intimidating. Does this hurt?
Right. Yeah. Nobody wants to hear about the needle, especially near the eye. And I wouldn't want an injection in the eye or anywhere in my body. But thankfully, this injection is done through a very, very small needle. And most people, report absolutely no pain with the topical anesthesia alone. So just basically a use of a numbing drop before the injection. Injection is painless, very fast, and can easily be done in the office, just like most other eye injections that we do. For example, we do that for a lot of patients with macular degeneration.
So if a patient has an injection, can they go home the same day? Or how long does this procedure actually take in the office?
That's right. So, injection really takes about 5 to 10 minutes, with the prepping and, checking to make sure that medication is properly in. And then, yes, they can go home. They can, in fact, drive themselves home because it won't change any vision. The only thing that they need to be mindful of is that we ask them not to lie down flat for at least a couple hours to make sure that the injected medication sits in the angle properly rather than going backside of the eye. It needs to stay in the front part of the eye.
And do patients have to take antibiotics or do anything special after the injection? And when would you see them back in the office?
Well, not necessarily. A lot of practice give antibiotics just to be on a safe side, but this is not required. In fact, we do a lot of injections and anterior chamber tapping for other reasons, and those patients are usually not given antibiotics because of a very, very low risk of infection. Oftentimes, assuming the medication lasts only for 3 to 4 months, if it's basically minimum, I would normally see them at about 2 months just to make sure that medication is working and pressure is lowered properly. And then I will see them in 4 to 6 months after that. It's very important that patients do follow up regularly because it's not something that lasts forever.
And as you brought up earlier, I just want to remind the audience that injections to the eye, again, we numb the eye very well. We make sure you're very comfortable, and we've been giving injections to the eyes for some time now. Many of our colleagues on the retina service or uveitis service actually give injections to the eye for various retinal conditions, diabetic eye conditions, a condition called uveitis or inflammatory disease of the eye. So doing injections for this, for glaucoma, is not anything that's like totally brand new because we've been doing injections for the eyes for some time. But it's exciting that there is now this option for glaucoma patients to have a medication that's like a sustained release where they can eliminate or reduce their burden on medications. And Jella, have you found that there have been some patients who didn't need to have surgery or, didn't have to use topical eye drops as a result of this procedure?
Yes, so that's a very good question. And thank you for clarifying the fact that, eye injection is really not new. But, as I explained, this medication is only supposed to last for about 4 months, but oftentimes, more than 6 months. But still, eventually that effect, will wear off. So I've seen a lot of patients who enjoy the drop-free period for several months to several years. But, oftentimes it is not given to avoid the surgery. The patient population who would really benefit from these injectable medication is those who have a temporary pressure increase due to some other medication that makes it worse. So, for example, patients with the active uveitis, they often need to be treated with a steroid for several weeks to months. If you have glaucoma, there's a very high chance that your pressure will spike with any kind of steroid use. So rather than doing a surgery for something that's so temporary, injecting this medication at the same time as treating with the steroid, that will give you a very good bridge solution until your inflammatory condition resolves and you can avoid the surgery that way.
What are some risks of this procedure and who would you not recommend it for?
So there is a very small risk, but it's a real risk, is that, since you're, putting injection in the eye, there is always a risk of infection. For that same reason, patients with any active or suspected eye infection, such as conjunctivitis or corneal ulcer, we don't do the injection in those patients. Another thing is that you are injecting high dose of prostaglandin analogs, which is, mildly inflammatory. So those patients with the already active inflammation or patients with a weak corneal cells or corneal membrane, it's a type of dystrophy called the Fuchs dystrophy, or patients who had a corneal transplantation for that reason are also excluded from this medication. Of course, if you have a real allergic reaction, not just irritation or redness, but real hypersensitivity allergic reaction to the bimatoprost drop, then those patients should not get this injection.
And who do you think is a good candidate for the injection?
So other than those uveitis patients who require a steroid, other patient who can benefit from it is those who anticipate a period of difficult usage of the daily drops, such as, you're going for traveling to places where you don't want to either worry about or have a difficult access to medication. Those who are planning a major surgery, usually eye drop becomes the last thing that you want to worry about. Any type of life events, or those who are planning or requiring a glaucoma surgery in the next few months but can't do it right away, so you can also use this injectable medication as a bridge therapy.
Now, I know that you're doing some really interesting work in this area. Can you tell us a little bit about it?
Yeah, so at Wilmer Bethesda Clinic, we have 2 clinical trials running at this time. One is just a phase 4 clinical trials evaluating how long the Duresta that's available in the market really lasts in clinical real-world situation, because the phase 3 trial that they used to get this medication approved by FDA was only required to run for a year. So that's really the only data that they have. There were occasional patients who came back for 2-year follow-up, and that's where they found that the medication lasts in some patients for up to 2 years. But, these patients need to be followed longer, and we participate in that real-world study. The other one, possibly even more exciting, is a phase 1 and 2 trials. This is an injectable medication that's not bimatoprost, but it's a cousin of bimatoprost that is known to be even gentler to the surrounding ocular tissue. So, this makes a repeat dosage even more safe and doable.
If there are patients who want to enroll in these studies, how can they do so?
So they can either contact our office. If they have not, they should really see a glaucoma specialist and then make sure that they don't have any contraindication and they meet all the study criteria. And then they can either contact myself or you or our study coordinator, Ala, who is stationed in Bethesda office.
Jella, I think that the work that you're doing is very fascinating. We're so glad that you're at Wilmer. I know that there are people who want to support your work. And how can they get in touch with you or your development officer?
So we have a development office that is stationed at Wilmer, Baltimore, but we are hiring our Bethesda officer here. I think the best way to reach us is really just contact us directly, our Bethesda office, and then we can connect you to the correct person. Just wanted to conclude that, the glaucoma is really known as a silent thief of vision. So oftentimes you have no symptoms until it's too late. So once you have symptoms, it's too late. So don't wait for the symptoms. The onset prevention is really worth a pound of cure here. So please get your eye screened if you haven't already for glaucoma. And if you have known glaucoma, keep up with the regular monitoring with your eye care specialist, for early detection and treatment and monitoring of the disease. It's very important to do so that you can maintain your precious eyesight and the best quality of vision and quality of life for a lifetime.
Very good advice. And for anyone who wants to try to get in touch with Dr. An, please email us at diagnosisglaucoma@gmail.com. And we can get you put in touch with her. Or if you wanted to come to visit us in the office, make an appointment with her, the phone number for the office is 240-480-1100. Again, thank you so much, Jella, for joining us. And it's been a pleasure. People are really going to benefit from the information you're sharing with this episode. So thank you.
Thank you, Dr. Kaleem, and thank you, everyone, for your attention.
Thank you for joining us. Until next time, your mom says take your drops.